section, the chair is authorized to declare a recess of the committee at any time. I now recognize myself for an opening statement. We're here this morning to discuss an issue of broad bipartisan concern, the critical need to overcome vaccine hesitancy so that more Americans get vaccinated against this deadly virus. I would like to thank Ranking Member Scalise for joining me in inviting witnesses to testify at today's hearing. This is not a partisan issue. The virus is equally dangerous for Democrats and Republicans, and the vaccines are equally safe and effective for Democrats and Republicans. I would like to also thank today's witnesses for taking the time to testify about this critical issue. The coronavirus vaccines authorized in the United States are proven to be safe and effective, and they have enabled our country to make significant progress in containing the virus and saving lives. We have a graph here that speaks for itself. As more and more Americans get vaccinated, fewer and fewer are dying from the coronavirus. Yet, too many Americans remain unprotected against this deadly disease because they are hesitant to receive coronavirus vaccines. This vaccine hesitancy is allowing the virus to continue to spread in areas with large unvaccinated populations and increasing the risk that vaccine-resistant variants will emerge. Polls show that up to 1 in 5 American adults say they are strongly opposed to getting a coronavirus vaccine. Vaccination rates are particularly low in the South and rural West. In both regions, less than 40% of the total population of multiple states is fully vaccinated. In my home state of South Carolina, for example, only 39% of the total population is fully vaccinated. Most concerning, we are still losing hundreds of Americans to the coronavirus every day. Nearly all of the more than 8,500 Americans who died from COVID-19 last month were unvaccinated. I want to repeat that. Nearly all of the more than 8,500 Americans who died from COVID-19 last month were unvaccinated. If more Americans got their shots, we could reduce coronavirus deaths to nearly zero. At this critical juncture, we must not lose sight of the work that remains to fully stop the spread of the virus in the United States. We must undertake dedicated efforts to overcome vaccine hesitancy and redouble our outreach and education so that we can find a way to convince those who are reluctant of the importance of getting vaccinated. We must overcome access barriers and address informational needs, particularly in communities of color, so that we can make it easier for everyone to get vaccinated. We must identify innovative ways to increase vaccine uptake. The Biden administration has made tremendous progress in making coronavirus vaccines available to all eligible Americans. They are continuing to work to enhance vaccine access for all communities and to promote confidence in the vaccines. Their unprecedented efforts have helped vaccinate more than 179 million Americans in record time, but more work is needed to prevent backsliding on this hard-fought progress. I look forward to hearing from our witnesses about the strategies that are effective to overcome vaccine hesitancy and increase vaccine uptake, and about how we can better inform the American public and encourage those who may be hesitant to feel confident in getting these shots. Once again, thank the members, the guests for being here today, and I now yield to the ranking member for an opening statement.